Question 1. In the context of quality management in medical imaging, Mr. Thompson, a radiation therapist, has noticed that a particular X-ray machine is producing inconsistent image quality despite regular maintenance. The radiologist suspects a misalignment of the machine's focal spot. Or should Mr. Thompson prioritize first, A. Reviewing the equipment performance parameters, including focal spot size, B. Immediately recalibrating the machine's KVP settings, C. Documenting the issue and submitting a non-conformance report, D. Replacing the X-ray machine's components without further investigation? Answer. Correct answer A. Reviewing the equipment performance parameters, including focal spot size. Explanation. A focal spot misalignment can lead to reduced image resolution, which affects the diagnostic quality of radiographs. Reviewing the equipment performance parameters, including focal spot size, is essential to identify whether this factor is contributing to the image quality issue. According to the ASRT guidelines, focal spot size and its act are vital components of equipment performance parameters that must be checked regularly in UC procedures. Recalibration of settings or replacing components should only follow after a thorough investigation of the problem. Question 2. Rodriguez is conducting baseline testing on a newly installed MRI scanner. During the testing, she notices some inconsistencies in the uniformity of the magnetic field. Which of the following actions would be the most appropriate based on quality control procedures? A. Report the inconsistency to the supervisor and schedule a service call. B. Continue with the test as planned and ignore the inconsistency. C. Document the findings, adjust the magnetic field settings and retest. D. Use the scanner for patient imaging and revisit the issue after a month. Answer. Correct answer. C. Document the findings, adjust the magnetic field settings and retest. Explanation. Uniformity of the magnetic field is a critical parameter for MRI scanners to ensure high-quality imaging and diagnostic reliability. The correct response involves documenting the inconsistency, adjusting the settings as required, and retesting the system to confirm proper alignment. This step aligns with continuous quality improvement and total quality management (EQM) principles, which emphasize proactive issue identification and resolution. Question 3. The hospital's radiation safety officer, Dr. Anderson, is reviewing the radiation dose optimization process for CT scans. He notices that the radiation dose for routine abdominal scans has been higher than recommended levels. According to ASRT guidelines, what should be his next step? A. Increase the scanning time to reduce patient exposure. B. Adjust the scanner settings to optimize the radiation dose without compromising image quality. C. Increase the radiation dose for all CT scans to standardize the process. D. Suspend abdominal CT scans until further notice. Answer. Correct answer. B. Adjust the scanner's settings to optimize the radiation dose without compromising image quality. Explanation. Radiation dose optimization is essential in ensuring patient safety while maintaining diagnostic image quality. The ASRT recommends adjusting CT scanner settings such as mask KVP and slice thickness to minimize patient exposure while preserving image quality. Dr. Anderson should focus on adjusting these parameters to achieve the optimal balance, rather than unnecessarily increasing the dose or halting procedures. Question 4. Given the circumstances of a new digital radiography doctor system installation, Mr. Baker, a medical physicist, is tasked with performing routine QC procedures. Which of the following is the most critical parameter to test first according to doctor system QC procedures? A. Signal-to-noise ratio SNR. B. Collimation and beam alignment. C. Image receptor sensitivity. D. Image contrast and spatial resolution. Answer. Correct answer. C. Image receptor sensitivity. Explanation. Image receptor sensitivity is critical in ensuring the proper functioning of doctor systems as it directly affects the image quality and patient dose. The ARC-QC guidelines highlight this as a key test as it ensures that the system can adequately detect and record radiation exposure. Other factors like spatial resolution and contrast are also important but should follow after confirming the system's sensitivity to radiation. Question 5. During the process of quality management (MS), a radiology administrator is reviewing the organization's compliance with the Joint Commission's accreditation standards for radiation therapy. Which of the following is mandatory element to ensure compliance with these standards? A. Routine testing of radiation therapy equipment and proper documentation of results. B. Recalibration of all radiation therapy machines every month. C. Offering continuous training for staff on new technologies only. D. Ensuring all patient imaging is completed without documentation of radiation dose. Answer. Correct answer A. Routine testing of radiation therapy equipment and proper documentation of results. Explanation. The Joint Commission accreditation standards require facilities to conduct routine testing of radiation therapy equipment and maintain proper documentation of the results. This is critical to ensure patient safety, regulatory compliance, and the quality of care provided. Recalibration, while necessary, is not required on basis unless specific issues arise. Continuous training is important but does not replace the need for routine equipment testing. Question 6. Mr. Thompson, a radiation safety officer, notices that the radiation dose for fluoroscopic procedures exceeds acceptable limits. In response, he needs to implement corrective actions. What is the first step Mr. Thompson should take according to ASRT's quality management standards? A. Document the issue and stop all fluoroscopic procedures until further investigation. B. Reevaluate the equipment performance parameters, such as dose rate, and adjust as necessary. C. Reduce the exposure time for all fluoroscopic procedures. D. Contact the hospital's legal team for guidance on how to proceed. Answer. Correct answer. B. Reevaluate the equipment performance parameters, such as dose rate, and adjust as necessary. Explanation. The first step in addressing radiation dose issues is to reevaluate the equipment's performance, particularly parameters such as dose rate and exposure settings. Adjusting the equipment settings to optimize radiation dose while maintaining image quality aligns with the ASRT's guidelines for quality management. Documenting. Halting procedures are only appropriate if immediate safety concerns arise, which is not indicated here. Question 7. In light of recent developments, a healthcare facility has introduced a new Total Quality Management (EQM) initiative aimed at improving radiation therapy services. Which of the following is most aligned with TQM principles? A. Focusing solely on compliance with regulatory requirements. B. Continuous evaluation and improvement of processes involving staff, equipment, and patient outcomes. C. Implementing strict oversight of equipment performance without involving staff feedback. D. Prioritizing cost reduction while limiting process changes. Answer. Correct answer. B. Continuous evaluation and improvement of processes involving staff, equipment, and patient outcomes. Explanation. TQM emphasizes a holistic approach to quality improvement, focusing on continuous process evaluation and improvement. In radiation therapy, this involves ensuring that staff, equipment, and patient outcomes are consistently assessed and improved. TQM also encourages a culture of collaboration and feedback from all stakeholders, which improves service quality and patient safety. Question 8. Mr. Park, a lead physicist, is reviewing the performance of the hospital's dose calibrator. He finds that the system is not providing accurate readings according to best practices. What is his next course of action? A. Ignore the issue if the readings are within acceptable tolerance limits. B. Recalibrate the dose calibrator according to the manufacturer's specifications. C. Replace the dose calibrator with new one immediately. D. Inform the department of the issue and resume daily operations. Answer. Correct answer. B. Recalibrate the dose calibrator according to the manufacturer's specifications. Explanation. Dose calibrator accuracy is critical to ensuring that patients receive the correct dose of radioactive materials. Recalibrating the system according to the manufacturer's guidelines ensures the accuracy and reliability of measurements. Ignoring the issue or replacing the calibrator without first attempting recalibration would be contrary. Established quality control protocols which prioritize accurate calibration before considering equipment replacement. Question 9. Considering the evidence gathered over the past month, a hospital radiology department has identified a trend of increased image artifacts in digital radiography systems. Which of the following could be the most likely cause of these artifacts? A. Insufficient collimation during imaging procedures. B. Inconsistent exposure settings across different radiologists. C. Fluctuating room temperature affecting the equipment. D. Incorrect processing settings in the image management system. Answer. Correct answer A. Insufficient collimation during imaging procedures. Explanation. Image artifacts in digital radiography can often be caused by insufficient collimation, which leads to unnecessary radiation exposure and potential issues with image quality. The ASRT guidelines emphasize the importance of proper collimation to minimize unnecessary exposure and improve image clarity, while other factors like exposure settings and processing settings contribute to artifacts. Inadequate collimation is the most direct cause. Question 10. In response to a report of repeated image quality issues with a newly installed Gamma camera ISTA-White, the radiology manager conducts a performance evaluation. Which of the following should be included in the evaluation according to standard QC procedures for nuclear medicine? A. Ensuring the Gamma camera's sensitivity and uniformity are within acceptable limits. B. Checking that only the Gamma camera's image processor is functioning properly. C. Limiting the use of the camera until the source of the issue is identified. D. Replacing the camera's detectors immediately. Answer. Correct answer A. Ensuring the Gamma camera sensitivity and uniformity are within acceptable limits. Explanation. Ensuring the Gamma camera sensitivity and uniformity are within acceptable limits is key step in maintaining high-quality imaging in nuclear medicine. According to ASRT guidelines, routine UC procedures for Gamma cameras include testing for these performance parameters. Identifying and addressing the underlying cause of image quality should be prioritized before considering equipment replacement. Question 11. From a practical standpoint, Mr. Garcia, a radiation therapist, is reviewing the documentation practices of his facility's quality control QC program. He notices that while UC tests are performed regularly, the results are recorded inconsistently across multiple platforms with some handwritten entries and others in Excel sheets stored in personal folders. He is concerned that this inconsistency might compromise traceability during or incident investigations. What is the most appropriate action Mr. Garcia should recommend to ensure compliance with best practices in quality management systems, QMS? A. Recommend that all QC documentation be digitized but allow each department to choose its storage method. B. Suggest that handwritten records continue for backup purposes. C. Propose centralizing QC documentation within unified, accessible electronic quality management system with version control. D. No action is required as long as all documentation is completed eventually. Answer. Correct answer C. Explanation. Centralizing documentation within a unified electronic QMS ensures traceability, accountability, and audit readiness, which are essential components of a compliant and functional QMS. The ASRT practice standards and ISO 9001 guidelines emphasize that documentation must be accurate, consistent, and securely stored with proper version control to support continuous quality and risk mitigation. Handwritten or decentralized storage methods increase the risk of errors, data loss, or unauthorized access and do not support real-time monitoring. Question 12. In light of recent developments, a radiology department is integrating total quality management (TQM) principles into their workflow, and management wants to empower all staff members to contribute ideas for quality improvement. However, some staff members are unsure of how their feedback will be used or whether it will be acted upon. Which of the following best aligns with the core philosophy of TQM in this situation? A. Feedback should be gathered quarterly and reviewed only by supervisors. B. Staff should be allowed to submit feedback anonymously, but no feedback loop is required. C. All staff must submit mandatory suggestions monthly to meet TQM quotas. D. Staff feedback should be encouraged, openly discussed, and integrated into process improvement with transparent communication of outcomes. Answer. Correct answer D. Explanation. Total quality management (TQM) promotes a culture of continuous improvement and employee empowerment. According to Deming's principles of TQM, feedback must be acted upon visibly to foster trust, collaboration, and accountability. An open feedback loop where suggestions are discussed and implemented when feasible reflects commitment to process ownership by all staff. Simply collecting feedback with transparency contradicts TQM ideals. Question 13. When analyzing the quality control of fluoroscopic equipment, a medical physicist performs a dose rate assessment and observes higher than expected patient entrance exposure rates, although image quality remains within acceptable limits. What should be the next step in managing this issue from a quality and safety perspective? A. Immediately discontinue use of the equipment until the manufacturer investigates. B. Recalibrate the dose settings and notify radiation safety for review. C. Ignore the issue as long as image quality is acceptable. D. Replace the image intensifier to reduce dose. Answer. Correct answer B. Explanation. The ASRT and SRP guidelines require optimization of radiation dose while maintaining diagnostic image quality. A high entrance skin dose may increase patient risk and violate ALARA as low as reasonably achievable. Principles recalibration, followed by a radiation safety review, ensures that the dose is within regulated limits without compromising image integrity. Discontinuation is permitted unless there's an imminent hazard. Question 14. Contrary to popular belief, calibration of a dose calibrator in nuclear medicine is not a one-time event. Which of the following best describes the standard practice for ensuring the ongoing accuracy of a dose calibrator? A. Perform calibration annually and verify constancy weekly. B. Constancy checks are performed monthly, while accuracy is checked daily. C. Only accuracy needs to be checked at installation. Ongoing UC is unnecessary. D. Constancy, linearity, geometry, and accuracy tests must all be performed daily. Answer. Correct answer A. Explanation. According to the Nuclear Regulatory Commission (NRC) and Open Report No. 181, dose calibrator QC includes constancy checks daily or before use, linearity quarterly, geometry, installation or after relocation, accuracy annually with at least 2 sources. Option A reflects appropriate practice aligned with regulatory requirements. Performing all tests daily. D is excessive, not recommended. Question 15. In response to a rise in imaging artifacts on CT scans, a technologist named MS Patel initiates a review and identifies the artifacts are primarily motion-based and occurred during exams of elderly patients. Which strategy best demonstrates a proactive approach to quality improvement in this scenario? A. Scheduling all CT exams earlier in the day to avoid fatigue. B. Replacing the CT scanner with newer equipment. C. Implementing motion reduction protocols, including clear patient instructions and immobilization aids. D. Reducing scan duration to minimize radiation dose. Answer. Correct answer C. Explanation. Addressing the root cause. Motion artifacts requires protocol optimization and patient-specific strategies such as pre-scan communication and use of immobilization tools. This aligns with continuous quality improvement. CKI methodology, focusing on process modification over equipment replacement. While dose reduction is important, it may not correct motion-induced image degradation. Question 16. The underlying principle of establishing tolerance levels and action limits in UC protocols is often misunderstood. Which statement best represents that purpose? A. Tolerance levels are subjective thresholds and do not require action when exceeded. B. Action limits are stricter than tolerance levels and require immediate discontinuation of imaging services. C. Tolerance levels define acceptable performance ranges. Action limits indicate when corrective measures must be initiated. D. Both tolerance and action limits are interchangeable and used for documentation purposes only. Answer. Correct answer C. Explanation. Tolerance levels define performance parameters within which a device operates safely and effectively. Action limits are boundaries that, if exceeded, necessitate investigation and possible corrective actions. This structure is integral to quality control documentation as recommended by OPM task group reports and asset quality standards, supporting proactive equipment maintenance. Question 17. Through the lens of image quality control in digital radiography, Dr. Easterly notices a persistent reduction in contrast on daily test images. Pixel shift calibration has been ruled out. What is the most likely cause and how should it be addressed? A. Dirty or damaged detector surface. Clean the detector and repeat UC tests. B. Excessive use of automatic exposure control. Switch to manual mode permanently. C. Processor malfunction. Recalibrate the X-ray tube. D. Inappropriate window level setting during post-processing, reprocess or archived images. Answer. Correct answer A. Explanation. In doctor systems, contaminants or physical damage to the detector surface can reduce image contrast and affect uniformity. The Oppen Report 93 recommends routine detector cleaning and UC valuations. EEC usage and post-processing issues can influence image display but are unlikely to be the root cause of consistent contrast loss across daily QC tests. Question 18. With respect to MRI safety, a new MRI ethnologist, MS, Nguyen, is unaware of the importance of spatial gradient magnetic field maps. Why is understanding spatial gradients critical to MRI quality and safety protocols? A. Because they determine the strength of the radio frequency pulse needed for fat suppression. B. Because they help assess the homogeneity of the main magnetic field. C. Because they inform site planning and safety zones for controlling projectile hazards. D. Because they ensure accurate positioning of the receiver coils. Answer. Correct answer C. Explanation. Spatial gradient maps are crucial for identifying areas of high magnetic field variation which pose projectile risks and influence zoning per ACA guidance on MR safety practices. Understanding these maps allows facilities to design safety zones and manage risks associated with ferromagnetic materials. Field homogeneity and RF parameters are important but not directly related to gradient maps. Question 19. Examining the consequences of improper gamma camera calibration, the QC officer observes poor uniformity in the resulting nuclear medicine images. What is the most likely source of this issue, and what should be the next step? A. Detect a nonlinearity. Proceed with linearity correction. B. Energy window misalignment. Perform energy peaking and uniformity correction. C. Isotope decay. Acquire new isotope sample. D. Inadequate collimation. Switch to a high-resolution collimator. Answer. Correct answer B. Explanation. Uniformity artifacts in gamma camera imaging often stem from energy window drift or misalignment affecting count uniformity across the detector. The NEMA NU1 2018 standard recommends energy peaking before uniformity correction. Isotope decay affects sensitivity but not uniformity. Collimator choice influences resolution, not uniformity directly. Question 20. The core principles of professional standards in radiation therapy emphasize role clarity, which best describes the responsibility of the radiation therapist under the ASRT practice standards during daily image-guided radiotherapy. IGIT. A. Solely responsible for adjusting treatment plans based on image guidance. B. Must notify the radiation oncologist of discrepancies and follow department protocols. C. Expected to alter beam angles when artifacts are present. D. Can approve treatment changes if credentialed. Answer. Correct answer B. Explanation. According to the ASRT practice standards for medical imaging and radiation therapy, therapists are responsible for recognizing deviations, documenting, and escalating to the radiation oncologist. They are not authorized to independently alter treatment parameters or plans, even if credentialed, unless explicitly allowed under institutional protocols and supervision. Question 21. When assessing the functionality of a linear accelerator's dose delivery system, quality control UC technologist notices slight variation in dose delivery to phantom after several treatment sessions. The variation is observed mainly with the small field sizes. What should be the most appropriate first step in addressing this issue? A. Perform complete calibration check of the linear accelerator. B. Check the alignment of the gantry and collimator and assess any mechanical issues. C. Review the treatment plan and confirm that the correct parameters were used during delivery. D. Replace the irradiated phantom and test with new one. Answer. Correct answer B. Explanation. Variations in dose delivery with small field sizes are often related to mechanical alignment issues or problems with the beam shaping devices. The first step should be to check the alignment of the gantry and collimator, as mechanical misalignments can lead to inaccuracies in dose distribution, especially in small fields. If mechanical issues are ruled out, then further testing such as a full calibration check would be necessary. Question 22. During the monthly quality control test of A Harris notices an issue with the slice thickness and spatial resolution of the scanner's images. The test phantom shows inconsistencies in the results. Which action is the most appropriate to resolve the issue? A. Recalibrate the slice thickness measurement only, as spatial resolution will correct itself. B. Review the software version and update if necessary, and ensure that no parameters were altered during the last routine check. C. Replace the X-ray tube to solve both the slice thickness and resolution problems. D. Increase the tube current to improve spatial resolution and slice thickness. Answer. Correct answer B. Explanation. Inconsistent results in slice thickness and spatial resolution could be due to software issues, incorrect calibration, or parameters that were altered during previous QC checks. It's important to review the software version, ensure parameters have not been unintentionally altered, and recalibrate the system. The issue likely lies with the system's configuration, not with hardware like the X-ray tube or tube current, which affect other aspects of image quality. Question 23. The quality control checks for a hospital's MRI system show that the signal-to-noise ratio (SNR) has decreased in recent imaging. The MRI physicist suspects a potential hardware issue. What is the most likely cause of the decreased SNR, and how should it be addressed? A. Increased coil temperature. Replace the coil immediately. B. Issues with the magnetic field homogeneity. Perform a magnetic shim and uniformity check. C. Decreased patient movement during imaging. Implement motion correction protocol. D. Reduced magnetic field strength. Recalibrate the gradient system. Answer. Correct answer B. Explanation. A decrease in signal-to-noise ratio (SNR) is typically related to magnetic field homogeneity issues, as an inconsistent magnetic field can degrade image quality. The shim process is used to correct these inhomogeneities, and a uniformity check can confirm if this is the issue. Other causes such as coil temperature or patient motion affect image quality differently, but not directly related to SNR in this context. Question 24. In a radiation oncology department, a patient complains of skin irritation during external beam radiation therapy, which had not been a previous issue. The radiation therapist reviews the patient's treatment history and notices that the dose prescribed was within the normal limit, but the patient's skin area had high dose gradient. What is the best solution to mitigate this issue moving forward? A. Increase the treatment dose to ensure the entire area receives adequate coverage. B. Adjust the bolus material to ensure even dose distribution across the skin. C. Continue the treatment as planned, as this is known side effect. D. Apply topical treatments to the skin during therapy sessions. Answer. Correct answer B. Explanation. A high dose gradient can cause skin irritation as the dose rapidly changes across the treatment field, often affecting the surface of the skin. Applying an appropriate bolus material helps ensure more uniform dose distribution, reducing the dose gradient on the skin surface and decreasing the likelihood of irritation. Increasing the dose or applying topical treatments without adjusting the bolus material does not address underlying cause of the issue. Question 25. In a routine calibration test, the output of a radiotherapy linear accelerator is found to be slightly below the expected values. Which of the following should be the initial action in response to this finding? A. Discontinue all treatments immediately until a full machine audit is conducted. B. Adjust the treatment dose parameters for all ongoing patients to account for the discrepancy. C. Perform a recalibration of the machine and check the radiation output with a phantom. D. Wait for the next scheduled quality control check to address the issue. Answer. Correct answer C. Explanation. When a radiotherapy linear accelerator shows a discrepancy in its output, the first step should be to recalibrate the machine and verify the output using a phantom to check if the issue is persistent or temporary. This approach ensures that the problem is identified and corrected. Discontinuing treatments or adjusting dose parameters without verification could lead to inconsistent patient care. Question 26. After analyzing the dosimetric data for a patient undergoing radiation therapy, the medical physicist finds that the dose distribution is inconsistent with the treatment plan, with a hotspot located in the target region. What should be the next step in addressing this discrepancy? A. Review the planning system and check for any calculation errors that might have occurred. B. Increase the treatment dose in the hotspot area to compensate for the underdose. C. Ignore the hotspot as it falls within acceptable dose tolerance limits. D. Perform a physical verification of the treatment area using dosimeters. Answer. Correct answer. A. Explanation. The first step when encountering a hotspot in the dose distribution is to review the treatment planning system for any potential errors in the calculation, especially if the hotspot is inconsistent with the original plan. This can be caused by factors such as misalignment or incorrect input parameters. Physical verification using dosimeters can follow if the issue persists, but addressing the root cause is crucial first. Question 27. In light of recent advancements, a hospital has integrated electronic quality management systems (ECMS) to enhance its quality control processes. What is the primary benefit of using an ECMS in a radiation therapy department? A. It reduces the need for any manual documentation and auditing. B. It allows for real-time monitoring and reporting of quality data, improving decision-making. C. It guarantees that all equipment will always be perfectly calibrated. D. It automatically performs all QC tests without technician involvement. Answer. Correct answer. B. Explanation. The primary benefit of an electronic quality management system (ECMS) is its ability to enable real-time monitoring and reporting, enhancing data accuracy and decision-making. It also helps with timely identification of problems and ensures that necessary steps are taken quickly to maintain quality standards. An ECMS does not completely eliminate the need for manual input or calibration checks. Question 20. A radiation therapy team is noticing a rise in incidents involving patient positioning errors during treatment. The team is considering using image guidance (IGT) to mitigate these errors. What is the most effective way to incorporate IGT into the patient treatment process? A. Implement IGT only for patients with complex treatment sites. B. Use IGT for all patients as a standard procedure for every treatment session. C. Introduce IGT only when there is a clinically significant deviation from the prescribed plan. D. Use IGT exclusively for verification of setup before the first treatment session. Answer. Correct answer. B. Explanation. The most effective use of image-guided radiation therapy (IGT) is to standardize its use for all patients to ensure optimal accuracy in positioning, which improves treatment outcomes and minimizes mistakes. Regular use of IGT ensures that even small errors are corrected before they can impact the treatment plan. Limiting its use to specific patients or sessions could lead to missed opportunities for improvement. Question 29. During a routine audit, the radiation oncology department identifies that a recent treatment was delivered with inadequate dose verification because of a failure to perform a necessary secondary check. Which action should be prioritized to prevent this from happening again? A. Perform daily checks on the primary treatment machine only and avoid secondary checks. B. Review the entire department's safety protocols and revise them to include more frequent secondary checks. C. Discontinue use of the machine until an independent review of its performance is completed. D. Shift responsibility for secondary checks to the radiation oncologist for verification. Answer. Correct answer. B. Explanation. To prevent future dose verification failures, the department should review and revise its safety protocols to ensure that secondary checks are consistently performed before treatment delivery. Secondary checks provide an additional layer of safety and verification to catch any discrepancies between the plan and delivered doses. Relying solely on the primary check or shifting responsibility to the radiation oncologist. Question 30. A new policy is introduced to standardize the approach to radiation protection for patients and staff in a hospital's radiology department. Which of the following should be prioritized in the new policy to align with regulatory standards such as the ALARA principle? A. Limiting radiation exposure time and maintaining appropriate shielding without considering patient comfort. B. Always performing diagnostic imaging regardless of the patient's medical history. C. Ensuring that radiation doses are as low as reasonably achievable, ALARA considering both patient and staff safety and minimizing unnecessary exposure. D. Prioritizing maximum diagnostic image quality over radiation protection considerations. Answer. Correct answer. C. Explanation. The ALARA principle emphasizes that radiation exposure should be kept as low as reasonably achievable, ensuring both patient and staff safety. This includes minimizing unnecessary exposures and ensuring the optimal balance between image quality and radiation dose. Prioritizing excessive exposure or ignoring patient comfort could lead to adverse consequences.